NMDP and the research program CIBMT have been dedicated to trying to address disparities in access to transplantation. And one of the important things that we realized was that we weren't ever going to be able to find fully matched donors for all patients in need, and there's a real disparity in the ability to find matched donors that are based on the racial and ethnic backgrounds of the patients. So in order for us to really provide access to a life-saving transplant for all patients, we had to do research to improve outcomes in the mismatched unrelated donor setting, because if you can use mismatched unrelated donors effectively, you therefore would have a donor for virtually all patients in need of a transplant. So we've been performing a series of clinical trials evaluating the use of post-transplant cyclophosphamide, or PTCy, in recipients of mismatched unrelated donor transplants. We call them MMUD. And through those trials, one of them has already been reported, called the 15 MMUD study. We currently completed the access study and are running another study called Optimize. But what we're finding is that the outcomes are actually quite good and comparable to what we would see in recipients of matched transplants. The trials have accrued really well, very briskly, so I think we're addressing an unmet need. And what's also remarkable is that the proportion of patients enrolled on the clinical trials who are other than non-Hispanic white has been greater than 50%. So again, we're really addressing these former or historical disparities in access to transplantation.